information you will listen to in this video is taken from the drug package insert. Cialis, a drug from the urogenital system and sex hormones group, is available in 2.5 mg, 5 mg, 10 mg and 20 mg tablets. The active ingredient of Cialis is TADALAFİL. What is Cialis used for? Cialis is used to treat male sexual function problems. In combination with sexual stimulation, Cialis works by increasing blood flow to the penis to help a man get and keep an erection. Cialis is also used to treat the symptoms of an enlarged prostate. It helps to relieve symptoms of BPH such as difficulty in beginning the flow of urine, weak stream, and the need to urinate frequently or urgently. Things to know before using Cialis. Before taking TADALAFİL, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Sexual activity may put extra strain on your heart, especially if you have heart problems. If you have heart problems and experience any of these serious side effects while having sex, stop and get medical help right away. Severe dizziness, fainting, chest, jaw, left arm pain, nausea. Before using this medication, tell your doctor or pharmacist your medical history, especially of heart problems, stroke in the past 6 months, kidney disease, liver disease, high or low blood pressure, a severe loss of body water, penis conditions, history of painful prolonged erection, conditions that may increase the risk of priapism, eye problems, bleeding disorders, active stomach ulcers. This drug may make you dizzy. Alcohol or marijuana can make you more dizzy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Limit alcoholic beverages. Talk to your doctor if you are using marijuana. Before having surgery, tell your doctor or dentist about all the products you use. Drug interactions may change how your medications work or increase your risk for serious side effects. This document does not contain all possible drug interactions. Keep a list of all the products you use and share it with your doctor and pharmacist. A product that may interact with this drug is Dosage. TADALAFİL can cause a serious drop in your blood pressure when used with nitrates, which can lead to dizziness, fainting, and rarely heart attack or stroke. Do not use TADALAFİL with any of the following: certain drugs used to treat chest pain, angina, recreational drugs called poppers, containing amyl or butyl nitrite. Do not take this medication with any other product that contains TADALAFİL or other similar medications used to treat erectile dysfunction. How is Cialis used? Take this medication by mouth, with or without food, as directed by your doctor. Do not take TADALAFİL more often than once daily. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. To treat the symptoms of BPH, take this medication as directed by your doctor, usually once a day. If you are also taking finasteride with this medication to treat symptoms of BPH, talk with your doctor about how long you should continue taking this medication. To treat erectile dysfunction, there are 2 ways that TADALAFİL may be prescribed. Your doctor will determine which is the best way for you to take TADALAFİL. Follow your doctor's directions exactly, since your dosage depends on how you are taking it. The first way is to take it as needed, usually at least 30 minutes before sexual activity. Tadalafil's effect on sexual ability may last up to 36 hours. The second way to treat it is to take tadalafil regularly, once a day every day. If you take it this way, you may attempt sexual activity at any time between your doses. If you are taking tadalafil to treat both AD and BPH, take it as directed by your doctor, usually once a day. You may attempt sexual activity at any time between your doses. If you are taking tadalafil once daily for BPH, or for AD, or for both, take it regularly to get the most benefit from it. To help you remember, take it at the same time each day. Tell your doctor if your condition does not improve or if it worsens. What are the side effects of Cialis? Headache, stomach upset, back pain, muscle pain, stuffy nose, flushing, or dizziness may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If this video was helpful for you, you can like audio and subscribe to the channel for support. I wish you healthy days.